Hi, I'm Ross Camidge. I'm the Director of Thoracic Oncology at the University of Colorado, and I'd like to talk to you about the Pacific trial. So the Pacific trial really transformed the care of stage 3 non-small cell lung cancer. Stage 3, you remember, is when there's either a large T stage or more commonly because there's N2 or N3 lymph nodes involved. Historically, with chemoradiotherapy, the cure rate, the 5-year survival rate, if you like, is usually no more than about 25 to 30% at best. But the Pacific trial changed all of that. So what was the design of the Pacific trial? The Pacific trial was a randomized study. You had completed chemoradiotherapy for stage 3 non-small cell lung cancer, and then you were randomized 2-to-1 to receive either durvalumab at 10 milligrams per kilogram every 14 days for up to a year, or placebo. The co-primary endpoints were progression-free survival by a blinded independent radiology review committee, or overall survival. Now in 2017, we got the initial data. The progression-free survival hazard ratio was 0.52 and highly statistically significant. The median progression-free survival 16.8 versus 5.6 months. It was well tolerated. The grade 3 and 4 adverse event rate, 29.9% with durvalumab, but 26.1% with placebo. I mean, remember these patients have had chemoradiotherapy. I think people were worried about the risk of pneumonia or pneumonitis. That grade 3 or 4 pneumonia rate was only 4.4% with durvalumab and 3.8% with placebo. The discontinuation rate for durvalumab was 15.4%, but it was 9.8% with placebo. And if you looked at patient-reported outcomes, they were very similar between the two arms. So a well-tolerated treatment. But perhaps what's been most exciting is seeing the overall survival mature over time. In 2018, we saw the 24-month overall survival rate, 66.3% with durvalumab, 55.6% with placebo, hazard ratio 0.68. Then we saw the 36-month overall survival rate. At that point in time, not a single patient had really seemed to pass on in the durvalumab arm. The overall survival rate was still 66.3% versus 43.5% with the placebo arm. And at ESMO 2020, we saw the 4-year overall survival rate, 49.6% with durvalumab, 36.3% with durvalumab with placebo, suggesting an overall something like a 13% absolute difference in overall survival, with medians running 47.5 and 29.1. So I think Pacific has really changed the standard of care, maybe the biggest change in stage 3 lung cancer in the last decade. It's certainly something to consider in eligible patients. Thank you for listening.